Hi, Stefan. My name's Katie. I've looked a
Hello.
little bit. Hi, sorry. I've looked a little bit over your initial intake, but I thought that maybe if it's all right with you, you could tell me a bit about what brings you in today.
My wife,
Okay. What do you mean by that?
she thought it would be a good idea if I came to see you today.
Okay, and that's due to your alcohol use?
I guess. I think that she finds that a problem. Yeah.
Yeah. So what about that has been problematic? Do you think from her perspective? Like for
Well,
instance, sorry, go ahead.
yeah. Well, I work long hours because I'm trying to get a business going. I'm a civil engineer. I do a form of civil engineering called structural engineering, and I have a business. We
Okay,
try to make places safe and comfortable for people.
nice.
Um, but I do it privately. My own business. I'm trying to find clients. So long days.
Yeah.
Sometimes the clients are very demanding, stressful work. So I usually need to unwind for a while after work before I go home. And we have a little one at home, a 3-year-old Constantine. I don't think he's old enough to know he's alive yet, or at least I don't know what to do with him. So I think maybe I leave Elena alone with him too much.
Okay.
And I think she's mad about that.
Okay. How do you feel about your alcohol use?
Well, that's the problem, I guess, because to me it's normal. I'm Romanian. We came from Romania. Originally came to the States and was hoping to settle there, but couldn't. So ended up coming up to Canada. And I met Elena in Hamilton. Um, but we drink. I mean, my family's poor. We come from a small village. My parents both in their 80s. I'm the youngest. I was born into a family where alcohol was normal. I mean, always, wine at dinner or whatever. So to me, it's just part of my life. I don't know. I don't know what the problem is.
Yeah, so it's very intertwined in kind of your cultural identity.
Yeah, exactly.
Okay. Yeah, I can see why that would be conflicting, to say the least. um,
And then
okay.
something that's so much a part of me in my life is now a problem for my wife. And I don't know what to do about that.
Yeah. Okay. Um, I mean, in the end, Stefan, it's going to be your call. This is your journey, whether you choose to come back or not.
Hmm.
My goal today is we have some standardized screening tools I typically go over
Okay.
while we're speaking.
Are you an engineer?
No, I'm a
Oh,
social worker.
oh, because we use tools too, So that's
Yes,
cool. Okay. I'm
most of
interested.
my tools are on paper.
Okay.
um,
Mine are in toolbox. Yeah.
yes, so
Okay.
we both have
Yeah.
different tools.
Okay.
Anyways, but there's a scale I kind of go through, and some of it is predetermined based on your age and gender. There's statistics regarding suicidal ideation. We screen all of our clients for that.
Okay.
It's
Because I'm not suicidal. I don't want to kill myself.
I believe you when you say that.
Okay.
I just want to be very open about the kinds of things that I'm looking for in this assessment.
Okay.
And I will let you know what your results are in all of them, and you can decide what you want to do with that information,
Oh,
because this
cool.
is your journey.
Sure.
But then there's a couple that are a little bit more formal. There's specific questions. If you want me to explain any of the questions or you don't feel comfortable answering them, you tell me and we can move on, or I can explain it for you a little bit better.
Okay.
Okay.
Yeah.
So I know you're here for the concerns your wife has regarding your drinking. So this might not apply to you, but we do this with all of our clients who come into our facility. It's known as the DAST-10, but it's a drug abuse screening tool. We'll just go through the answers. I will let you know how you score.
Okay.
Sound
Yeah.
okay?
Yeah.
Okay. Have you ever used drugs other than those required for medical reasons?
No, I don't think so.
Okay. Well, then the rest of these are pretty much not applicable.
Oh,
So, because if you're not using any drugs other than medications, you wouldn't be using more than one drug at a time, even if it was a medication or as not prescribed.
when you say drugs, you mean like pills and things?
It could be medical drugs. They could be prescribed from a physician and taken not as prescribed, or it could be
Oh, yeah.
a street drug, either.
Yeah, no, I don't get my drugs off the street.
Okay.
I have some anxiety,
Mhm.
and so I have taken medication for the anxiety, but that's just as prescribed. Yeah.
Okay. Thank you.
Yeah.
And so your partner has not had an issue with anything regarding medications, etc.
No, I don't think so. She just complains about me going to the bar.
Yes. Okay.
Oh, she complains about other things too, but not about any drugs.
Okay.
She wants a bigger house. She wants a better neighborhood. She wants, yeah, I understand. Someday.
Yes, someday. These things take time.
Yeah.
Okay.
I'm only 33. You'd never know it to look at me, but it's a very stressful job.
Yeah, I can only imagine. It would be, I can imagine. So the drug abuse screening test, no surprise to either of us. We have no problems reported.
Okay.
So this one is called the Michigan Alcohol Screening Test. It's a bit more applicable to your situation.
Okay.
We'll go through the questions again. Any questions, you let me know. If you need to take a break, you let me know. If you're feeling uncomfortable, let me know and we can talk about it.
Sure. Okay.
Okay. Okay. Do you feel that you are a normal drinker? So normal
Yes.
being sorry.
I would say
Okay.
yes. Yeah.
So that's being
But sorry, you were starting to define what normal is.
yes.
Yeah.
So drinking as much or less than most people.
Most people, or most Romanians, or most
people.
engineers.
I would say just most people.
I think I drink it. There's a lot of people at the bar that looks like most people are there.
Okay.
I think probably, yeah, I see myself as a normal drinker.
Okay.
It's not that much. Anyway, yeah.
Have you ever woken up in the morning after drinking and found that you could not remember a part of the evening?
Yeah, but well, that's normal, isn't it?
I
Like, you
mean,
know,
in my experience, I would say no.
okay.
But we score this at the end, and then I tell you what the results are,
Mhm.
and you can do with that what you will. I might have recommendations if you're open to hearing them, but again, I want you to know, like, you're kind of steering this ship, if you
What was
will.
the question again?
If you've ever woken up in the morning after drinking the night before and found that you could not remember part of the evening.
Yeah, I would have to say yes, because I have, not often, but sometimes woken up in the morning in a place that I didn't recognize, and I didn't know how I got there. So I guess that fits what you're saying.
Mm-hmm.
Yeah. Okay. Yeah.
Um,
Is that bad?
I wouldn't label it as bad or good. Coming
Okay, it's
from
just
my,
the test.
it is, and it just is what it is.
Okay.
And should you ever come to the determination that you have a drinking problem or whatever you want to refer to it as, that doesn't make you bad, in my experience. Most people that
Okay.
we've met. Okay.
I like the way you are keeping me in the driver's seat.
Thank you. So a real relative or close friend ever worry or complain about your drinking? such as your
My
spouse.
wife, yes.
Yes.
If she is a relative or friend, then I would have to say yes. Yes.
I would say she is.
Okay.
Um, okay. Can you stop drinking without difficulty after 1 or 2 drinks?
Sometimes yes. I would have to say sometimes I'll have 1 or 2 drinks and it feels like it's not enough and I don't want to stop or I can't stop or something. So can I stop after 1 or 2 drinks? Sometimes no, I guess. I don't know
Okay.
how to,
So I'm a bit limited as to what I can
I have to
check.
say yes or no.
Yeah.
Ah,
Sorry. I know it's
um,
not that black and white. It's just the way the test's written.
I guess I can't stop after 1 or 2 more often.
Okay. Do you ever feel guilty about your drinking?
Well, I'm feeling guilty now as we're talking. Um,
Okay.
I think with Elena, I just get annoyed. I get mad. I don't.
And what makes this different?
Um, you're not yelling at me the way my wife does. So I'm thinking about it more, and I think because the more I think about it, the more I feel guilty or ashamed or something instead of mad because there's no one to be mad at, really. Yeah, that's all. It's the not being able to stop drinking. I'm still thinking about.
That's fair.
Yeah.
Okay. Have you ever attended a meeting of Alcoholics Anonymous?
No.
Okay. Has drinking ever created problems between you and a relative or close friend?
Yes.
Has anyone in your family or any close friends gone to help on their own about your drinking?
I don't think so. I think Elena just has asked me to do something.
Yeah, that makes sense.
Yeah.
Have you ever lost friends because of your drinking?
No, I don't think so. Although I might lose my best friend if this keeps up, you know?
Correct. Yeah,
Yeah.
that's a fair point.
Yeah.
Um,
Well, not yet.
yes, let's hold on to that.
Right.
Have you ever gotten into trouble at work because of drinking?
Yes.
All right. Has it resulted in a job loss?
Yeah, I lost a contract because it was one of those times I woke up and I didn't know where I was the next day.
Mm-hmm.
And I didn't know where my car keys were. And I couldn't get to the job site on time and I lost the contract.
I'm sorry.
Yeah. It hasn't happened much, but it has sometimes been a problem.
Fair.
Yeah.
Okay. Have you ever neglected obligations related to like family, work, for 2 or more days in a row because of your drinking?
2 or more days? No.
Do you drink before noon fairly often?
Not usually, no. I usually drink in the evening.
Okay. Have you ever been told that you have any liver trouble, such as cirrhosis?
No.
Okay. We're almost done. This one.
Okay.
All right. Okay.
This is still the Michigan test you're doing?
Yep. It's
Oh, cool.
22
Okay.
questions.
Okay.
We're almost done.
Nothing about Michigan in it, though.
No, not so far.
Oh, okay.
I think it's called that because it was developed by someone from Michigan.
Okay.
Yes.
Yeah. I wanted to settle in Upper Michigan, but they wouldn't let me stay. Yeah.
No
Anyway, sorry.
worries.
Okay.
Okay. Okay. Have you, after heavy drinking, Have you ever had, so these are called DTs, they're called delirium tremens. So you could be experiencing hallucinations and shaking. So visual or auditory sounds that no one else can hear, and severe shaking.
I've had the shaking before, yes.
Okay, so not the hallucinations.
I don't think so. Just
Okay.
really bad hangovers, and I feel sick and shaky,
Yep.
and sometimes body actually, like hands actually shaking. Yeah.
Before today, have you ever gone to anyone for help due to your alcohol use?
Well, you asked me about Alcoholics Anonymous. I almost went to a meeting once. It was at a church downtown, and I drove to the parking lot, but I didn't go in. So I don't know if that counts.
I mean, I think it doesn't count as seeing somebody, but on a personal level, I would think that one, that's pretty understandable. Walking into those rooms can be pretty daunting.
Hmm.
The first few times for sure, it's a new environment, new people. For some, it can be like walking in is admitting that there's an issue.
Mm.
But I'm gonna say no because you didn't attend.
No, fair enough. Okay. Yeah, that seems like the right answer to me.
Yeah. Okay. Have you ever been hospitalized due to your drinking?
No.
Okay. And you've never been in, has drinking ever resulted in you being in the psychiatric ward?
No.
Okay.
I think Elena called the police once or twice because she didn't know where I was.
Okay.
But I met with them and I told them I was fine and I was going home and it was all good. So they did not take me to the hospital or anything.
Okay. So have you ever gone to any doctor, social worker, a member of the clergy, or a mental health clinic for help with any emotional problem in which drinking was part of the issue?
Once, yes, I talked to the priest.
Okay.
Yeah.
Have you ever been arrested more than once for driving under the influence?
No.
Okay. Have you ever been arrested or detained by an official for a few hours because of other behavior while drinking?
Well, I say no, and I think I was lucky, but yeah, no.
Okay.
Yeah.
So we're done masked. The way all of these are going to work is at the end of our session, I'm going to just take a few minutes to do the tallies for you, and then I'll come back in and we can chat over the results for the remainder.
Okay.
The last thing that I would like to do with you is called the trauma symptom checklist.
Okay.
And it's just, we're going to tick off. So you rate this on a scale of 0 to 3. 0 would mean never, and 3 would mean often. So this has a bit more of a middle ground than some of the previous questionnaires.
Okay.
Okay. So in the last month, have you experienced any of the following? Headaches,
Yes. Oh, so often 3.
okay. Insomnia,
Oh, 1.
okay. Weight loss without dieting,
0.
okay. Stomach issues,
2.
sexual problems,
2.
okay. Feeling isolated from others,
2.
Flashback, so sudden and vivid distracting memories.
Somewhere between 2 and 3, maybe 3.
Restless sleep,
2,
low sex drive,
2,
anxiety attacks,
3,
sexual overactivity,
0.
um,
I wish. No.
loneliness.
Loneliness,
Yeah.
2,
Two,
3.
3. Okay. Thank you.
Yeah.
Nightmares.
Depends on how much I drink, but 2.
So do you find you have more nightmares when you don't drink?
Yes.
How about spacing out, kind of like being distracted from the present?
Oh, between 1 and 2. Let's say 2.
Okay. Sadness,
3,
dizziness,
0.
not feeling satisfied with your sex life,
3,
trouble controlling your temper,
1,
waking up early,
3,
uncontrollable crying,
2,
fear of men.
fear of men.
Yep.
0.
Okay.
The fear of women.
Not feeling rested in the morning,
3,
having sex that you didn't enjoy,
0.
trouble getting along with others.
Does that include Elena?
I would say yes.
Oh, 2.
Memory problems,
I'm thinking about what you said earlier. I'd have to say 1 or 2. Let's say 1.
okay. The desire to physically harm yourself.
Oh, 0. Well, yeah, 0.
Okay.
Sorry, I was thinking as much as I like the drinking, it seems to be a form of self-harm.
Fear of women.
3. Fear of woman. But
Okay.
yeah.
Singular, yes, I understand.
Ah,
Waking up in the middle of the night.
at 2.
Bad thoughts or feelings during intimacy.
2.
Passing out.
3. Well, 2. 2.
2? Okay.
I don't pass out. Yeah, I was thinking the passing out significant, but not all the time. Yeah.
Feeling things that are unreal.
2.
Unnecessary or over frequent washing of yourself.
Oh, 0.
Feelings of inferiority.
1.
Feeling tense all of the time.
3.
Being confused about your sexual feelings.
0.
The desire to physically hurt others.
0.
Feelings of guilt.
3.
Feeling that you are not always in your body.
1. Sometimes, not all the time.
There. Trouble breathing.
0.
Sexual feelings when you shouldn't have them.
1.
Okay.
You mean like being attracted to someone other than Elena? That kind of thing?
No. So in a situation that wouldn't normally cause you to feel sexual arousal, kind of just having it.
Oh, no, 0. I see.
Okay.
Yeah, 0.
Okay. Well, that one, I know that one can be a bit more invasive. So how about we take a little break?
Sure.
And you can go get some coffee from the front room if you want.
Okay.
And then I will call you back in after I've done the scoring and we can chat about the results. And again, yours to decide what you do with.
Can I really go for coffee?
Yes.
Yeah, okay. I'll be back.